If you have knee pain, I'm sure you've made at least one of these 5 mistakes that are completely delaying your recovery. So stay until the end of the video because it's worth listening to them carefully. It's likely that during those times when you suffer from knee pain, you've made some of these mistakes. This situation is understandable. You may feel disoriented, trying to avoid hurting yourself more, or you may have heard advice that is not very appropriate or is outdated, even from doctors and health professionals. That's why I made this video. I want to help you understand episodes of pain, and I want to help you make the best decisions so you can recover as quickly as possible. So I'm going to present these 5 mistakes to you quickly, based on science, with solid support from personal experience. The first one is being afraid. Fear or worry about pain are quite common reactions. However, it's crucial to approach these difficult moments with calmness. Succumbing to panic only leads to an increased perception of pain, fueling the belief that you won't overcome this situation or that there's no solution at all. This happens a lot. People who find out they have knee osteoarthritis start thinking that if the osteoarthritis doesn't go away, they'll never get any relief. Pain is a very, very complex mechanism that even today is hard for us to understand, and it doesn't depend on just one factor. You should understand that experiencing pain is a natural part of life. Lack of sleep, physical exertion, and stress are important factors that can contribute to the development of clinical, and it is. Look at the mind, Ecclesia. Beautiful gestures in your mind, voice, one tone just like a song of love. Fans, Montes. That you can increase the sensation of pain simply if these thoughts flood your mind. You just have to think of a child who has hurt himself, a boo-boo, a wound, and how does he overreact even though that injury is minor? So put on a band-aid like a child would on the wound. Completely remove those thoughts from your head. Focus on the good and on the positive things you can do with your legs since they are completely fine. And a few days of pain won't change that. So is the pain really real and associated with damage that exists in your joint? Or is it rather induced by panic and the thoughts you have in here? A very interesting reflection. Second mistake, avoiding movement and resting all day out of fear of causing more pain by moving. It's one of the worst decisions for dealing with an acute episode. After 3 days of complete rest, the muscle fibers start to atrophy, which reduces your knee's ability to tolerate effort. More rest means more weakness and less tolerance to movement. Controlled low-impact exercises help you maintain mobility and muscle strength. There are a lot of easy, simple exercise alternatives that you can do while barely moving your joint, and they will help you fight against that inactivity and atrophy. Make sure to try gentle exercises adapted to your abilities like the ones you can find on my channel. I have hundreds of videos. These exercises won't make the pain worse, nor will they make your situation worse. Instead, they will help you maintain those physical abilities, so that after that episode, you won't have trouble getting back to your normal life, nor will you have more pain. Because of that deconditioning, the only rest we really need to value is the hours of sleep we get at night. And I'll throw a good question at you here. When you have knee surgery, where does the real problem of the operation actually come from? Or from the time we spend resting without moving the knee after surgery? Well, most of the time it's because of that period of inactivity. There are studies that show we lose around 3% to 5% of muscle mass in just 1 week. Imagine if we extend that over months. Imagine if we do it at an older age, where it's much harder to regain that ability, that amount of muscle in the legs. Third mistake, putting on a knee brace. The knee brace can be a double-edged sword. On one hand, it can help you reduce discomfort during episodes of more severe pain, acute pain, or make your knee more stable when it's supported while you exert yourself. However, on the other hand, using it constantly has serious consequences for joint health. Think about it. By using it, we are replacing the important stabilizing function of the muscles surrounding the knee. If we use it for months, over time, the muscles will stop performing this function and will atrophy, just like what happens with rest. Actually, muscle atrophy is the loss of fiber diameter, the loss of strength and capacity. Anything you don't use in your body, you end up losing. There's a very good expression in English. I'm not a great English speaker, but it goes like this: use it or lose it. When those muscles atrophy, they're going to promote instability in the knee, making the knee less functional. And when faced with a bit more stress, like going upstairs or getting up from a chair, pain appears more easily. Constant use of the knee brace gradually creates a dependency for doing your daily activities. Until it gets to the point where you take it off, you have pain, you put it on, you don't have pain. So, what do? You decide to use that knee brace every day of the week, from the moment you get up until you go to bed. It's a vicious cycle that keeps feeding itself. More weakness, more pain, more need for the knee brace, and so on constantly. Therefore, my recommendation is to use a knee brace only for those activities that are more demanding, for those moments when there is really a lot of pain, and for a short period, no more than 3 days, 7 at the most. I recommend 3 days at most, okay? But never go over 7 days. Never exceed that important number, because it can have serious consequences. Don't forget, every time you stop using your muscles, you're going to start losing those abilities. And if we're older, again, those are abilities that will be very hard to recover and will require a lot of time and effort. We lose things very quickly, and unfortunately, we recover them very, very slowly. That's just how our body is. Fourth mistake, not giving sleep enough importance. Sleep is the foundation of recovery, whether you have an injury or you're going through a period of more pain. Prioritizing sleep quality is essential to shorten the recovery process. I've mentioned this before. Pain is not just about your knees, but about a lot of factors that exist around you, your body, and your abilities. They make pain appear or not appear. We are not just a knee. We are not knee osteoarthritis. We are not knee wear and tear. We are not meniscus problems. We are a person with a very individual context. During sleep, a series of crucial biological processes take place that contribute to overall health and well-being, and they play a crucial role in regulating mood, helping us, for example, to maintain a healthy emotional balance. Lack of sleep leads to more pain, induces more negative thoughts, and slows down the healing and recovery process, because it's during the night when we sleep that our body regenerates. So just imagine the impact this really has on your pain and your recovery at the cellular level. During sleep, all those repair processes and toxin elimination take place, which obviously helps maintain the good health of tissues and organs. When the pain in your knees is intense, falling asleep can be quite a challenge. I completely understand. You can use different types of pillows to place them between your knees or under your knees if you sleep on your back. I personally recommend nursing pillows, the ones mothers use to breastfeed their babies, because they are very adaptable, can be easily placed between or under your knees without any effort, and they tend to be very, very lightweight. Placing it, especially between your knees if you sleep on your side, is very helpful for meniscus problems, as is placing it under your knees. It's very helpful for people who experience pain when their legs are fully stretched out. You might say, "Hey Marcos, but I move around a lot during the night." Well, the important thing is that you manage to get through that first moment of sleep, that you manage to fall asleep quickly, because then the rest of the night will go better. And if you wake up because of the pain, you can get back into a position that I call safe, where you have less pain and it's easier to fall asleep. And here's an interesting fact for you. I don't know if you know Roger Federer, a great tennis player. When he started to reach a certain age, after 35, he saw his athletic performance drop drastically. He had a year in which he didn't achieve great things compared to previous years, obviously, and he started to prioritize sleep. Instead of sleeping 8 or 9 hours, he ended up sleeping up to 10 or 11 hours a day. This allowed him to regain exceptional ability and to face players much younger than him with excellent condition, and to continue maintaining his dominance for many years. An example, a very powerful anecdote that shows us the importance of sleep in recovery, especially for athletes. I recommend you try to go to bed earlier than usual. Okay, don't expose yourself to TV screens or mobile screens, alright? And if you do expose yourself to them, well, make sure to use one of those orange light filters, or use these types of glasses that help block blue light. Because blue light blocks the production of melatonin, a substance that's essential for getting good sleep. So avoid exposing yourself to these types of screens before going to sleep. Have dinner at least 2 hours before going to bed and keep the room temperature about 18 degrees Celsius. Follow these recommendations when you're going through a more intense pain episode and try to go to bed a little earlier. And I assure you that this will be a key factor when it comes to recovering from that pain and getting back the life you had before. We've reached the fifth mistake, ignoring the pain. Many people do this. They start to feel pain and keep doing activities that cause them pain, completely ignoring it. I know this because of my mother. Honestly, she kept doing a lot of activities even though she was in pain, as if we were ignoring it, as if nothing was going to happen. Please, it's better to take a moment to reflect, to think about what causes us the most discomfort, and set it aside for a while during that episode of pain. Don't worry, because now, at the end of the video, I'm going to teach you how to tell the difference between intense pain and what isn't. Is it okay to ignore knee pain and keep going with intense activities? It can be tempting, right? Especially if you have some weekend plans or a commitment, some activity you've planned and you don't want to cancel it, or you've been waiting for it for a long time. However, it's crucial to understand that both complete rest and excessive activity are strongly discouraged. Ignoring the pain can make the injury worse and prolong the recovery time. It's essential to pay attention to the signals your body sends you and take the necessary time to heal properly. I always say that exercise, activity, and rest are like a balance. You always have to stay balanced. If we rest too much, the pain will persist. If we exercise too much and don't rest enough, the pain will persist, regardless of your condition. If I go out tomorrow to run a marathon and sleep little, since I never run marathons, I'm going to have knee pain. That's right, and even if I do a simple activity, exercises like the ones I do in my videos, and I sleep very little, it's possible that in the following days I'll have knee pain. It's as simple as that, without looking for any cause, without knowing if it's the meniscus, osteoarthritis, or the kneecap that's causing it. Pain doesn't work like that, and I hope this video helps you let go of that idea. If you have an intense, scheduled physical activity and you experience knee pain, it's important that you take a moment to assess your situation. For example, you could put on a knee brace. That's not bad, right? Or maybe you sleep a lot more the night before so your body is more ready. Instead of forcing that activity and potentially making the injury worse, consider the possibility of canceling it, modifying it, or postponing it to reduce the impact on your knee. I've had a lot of patients with knee pain. You have no idea how many. And many of them, after working with me, after getting better, they contact me. 1, 2, 3. A year later telling me, Marcos Sacristan, I've started having knee pain again. And most of the time, it's because of these two things. The first one is stopping the knee strengthening exercises, strengthening stability and mobility. And secondly, doing an activity that's too demanding. Marcos Sacristan, I've started playing paddle tennis again and my knee started hurting again. Basically, your knee wasn't ready for that kind of intense activity. I always recommend, instead of doing very intense activities, working progressively with exercises that gradually increase in intensity. And always listen to our body, the pain it generates, the pain that our knee, that our body interprets. These are signals that we have to respect so we don't push beyond our limits. More pain doesn't mean we're going to recover faster. Let's get that idea out of our heads. Always remember, listening to your body is essential for a successful recovery. If you experience pain during physical activity, don't ignore it or underestimate it. Giving yourself the time and space needed to heal properly is essential to avoid not only complications now, but also relapses in the long term and to ensure a full recovery. Earlier I talked to you about this pain scale. I really like it. It's one of my favorites, and I use it in almost all of my programs. And it helps us distinguish between discomfort and real pain. I always rate pain between 0, meaning no pain, and 10, the worst pain you've ever experienced in your life. Obviously, these numbers are very personal. Yours, right? It's not the same for everyone. A person who has had multiple surgeries, who has had to go to war, and who has suffered a lot of physical pain or a lot of physical effort, compared to a young person who has never had any kind of experience with pain, and who, for example, doesn't do any kind of exercise. So each of us has a different 0 and 10, and we can't compare them to each other, okay? Each person is an individual and has their own sensations and individual experiences. Very good. Remember that, okay? This also applies whenever we have pain that is between 0 and 4, we will consider the pain as low, mild, and safe. What does this mean? It's normal to have some discomfort. When exercising or doing a slightly more intense activity, it's completely normal. And these levels of pain simply tell us that we've pushed a little beyond our limits, but that's okay. The pain starts to go beyond 3. We're at 4, 5, even 6. Be careful there, friends, because we're entering a dangerous zone where I recommend you lower the intensity, give yourself more rest, use a knee brace, but only for short periods of time. And if the pain is much higher, in these cases, 7, 8, 9, 10, it's better not to force your knee with additional exercises, right? Evaluate what you've been doing in the previous days to know what could have caused that pain, and make use of more passive treatments, such as medication, massages, or bed rest. I'm not talking about staying in bed all day, but rather sleeping more to improve that pain in the short term and start moving those knees. We've reached the end, but I don't want you to leave without checking out a video that I also recorded for you and left for you up here in the upper corner of the screen, where I give you the keys and the important pillars to work on when it comes to relieving your knee pain, not just now, but forever, throughout your whole life, where I show you what tools you need to have in order to manage that pain right now. How to build a knee that is capable of handling your daily activities. You have it up there in the video description in the first comment. I recommend you watch it so you can open your eyes a bit and see what really works and what gets results. I just hope you liked this video. Watch it again because it has a lot of information, really valuable training, and it's also hard at first to catch the whole message. I sincerely thank you for staying until the end of the video. I hope you can share it with people who need it, with people who have knee pain, people who might be making some of these mistakes we've talked about, right? Because I'm sure it's going to be extremely useful and it will help them get out of that episode of pain. I'm saying goodbye, sending you my regards, and thanking you again, hoping to see you again in another video. Bye, friends.